eQuez. Your quest for education starts here. Welcome to eQuez Audio.
Hello, everybody. I'm Margaret Feldman, the founder of eQuez, a platform that helps students discover careers, find best fit schools, and make smart choices about higher education. This is episode 4 of Inside with eQuez, where we take an inside look at the journeys and lives of students and professionals who are studying to enter or work in a particular career. Today, we are speaking with Dr. Ernest Isaacson, a board-certified podiatrist in New York City. After listening to this episode, if podiatric medicine sounds interesting to you, visit eQuez.com, that's EQUEZ.com, to get connected to best fit podiatric medical schools. Dr. Ernest Isaacson graduated from the Scholl College of Podiatric Medicine at Rosalind Franklin University of Medicine and Science. After completing comprehensive training in various medical specialties, including internal medicine, general surgery, orthopedic surgery, and more, Dr. Isaacson went on to a podiatric surgical residency. He is active in research and publication in basic and clinical science. He maintains memberships with the American College of Foot and Ankle Surgeons, the American Podiatric Medical Association, the New York State Podiatric Medical Association, and the American Diabetes Association. Now, let's hear from Dr. Ernest Isaacson. Dr. Isaacson, we are so excited to have you. Thank you so much for joining.
Thanks for having me.
Well, let's just dive right in here. So how did you first discover podiatry?
Well, I first found podiatry when I was in college. I was always pre-med, and I was always, well, I guess I wasn't always pre-med, but I was always interested in medicine.
Okay.
I kind of looked around at different specialties. Podiatry seemed interesting, and I think I found it mostly in college. Somebody turned me onto it. I think it was my pre-med advisor, and it just seemed like an interesting field at the time because there's a lot of different stuff you can do in podiatry.
Sure.
I looked at medicine, I looked at dentistry, and I looked at podiatry, and podiatry just seemed like fun and diverse and a little bit more streamlined at the time, not so much anymore.
Okay.
And it kind of all worked out. So sort of serendipitously, I would say. Yeah, however I got into it. But I always had an interest in medicine. I was always going to do something in the medical field.
And what sort of tipped the scale in favor of pursuing a DPM versus a dentistry degree or a MD or DO degree?
The truth is I ended up applying to dentistry and podiatry. And when I went for a podiatry interview, it turned out to be from a pretty prominent and well-known podiatrist, which I didn't know at the time, but he just seemed like a nice guy. And he asked me, why do you want to spend your life as a dentist? How are you going to develop a relationship with your patients when you have your fingers in their mouth all the time? And so that was a little tongue in cheek or finger in cheek. But I don't know, that kind of hit me. And I liked what he said. He was one of the things that did it for me.
Okay.
I liked that it was a surgical field and there was a little sports medicine and there was a little bit of everything. I guess it was listen, it's a good decision because I like it. I don't know if the same thought process would have led me into it again, but I do like the field and I'm happy with my choice.
Excellent. Well, good to know. Is there a particular area in podiatry that you specialize in, or do you do more general work?
I do a little bit of everything. Okay. I have 2 different practices. So I have one practice in Midtown Manhattan and I have one practice in the Bronx.
Okay.
So as you might imagine, the demographics and the population are a little bit different in each practice, but there's a pretty good amount of overlap between the 2 practices. In the city, I do a lot of sports medicine as well as general stuff. So I treat a lot of runners. I also do a fair amount of surgery, which is, I kind of like that. It's the fun part for me. I do like the surgery. I do a pretty good amount, and I say that I'd like it to be my focus, but I take whatever comes in. I do everything from infants to old ladies and old men and everything in between. So you never really know what's going to come in. Today I had a bunch of warts, some ingrown toenails, so pretty much garden variety podiatry stuff. And then I had a woman with a huge splinter in her foot, which you'll be able to see on my Instagram account soon enough. And and then I had some post-operative patients and just a couple other just variety. You never really know what's going to walk in. So I do a little bit of everything. In the Bronx, I focus a little bit more on diabetic foot care,
Okay.
hopefully prevention and some treatment. So we deal with some wounds. Unfortunately, we deal with some amputations, and for the most part, though, it's prevention. It's trying to prevent the amputations from happening. So that's it's a little bit of a I would say, a sicker population in the Bronx in general, and I mean that in the nicest and most complimentary sort of way. But it's just, the reality is the Bronx is the sickest borough in the city by any measure. So that's we're dealing with the effects of that.
Got it. And what are some of the different types of surgeries that you do?
I do a lot of work on bunions and hammer toes, which is pretty much the bread and butter work of any podiatrist, but I do a little bit of whatever comes in. So I do work on tendons, and I do some trauma, not a whole lot. We do reconstructions of various things, so flat foot reconstructions, or things that are just various deformities, and then there's sort of the soft tissue things and little lumps and bumps. But the bread and butter of what I do is bunion deformities, where the big toe is going west, and you get the golf ball on the side of the toe. That's the short story of what a bunion is, and so I do a lot of work with those, and various arthritic type of conditions. Over the past few weeks, I've had a pretty good variety of a lot of different things, and it's we like that. We like to shake it up a little bit.
Okay, excellent.
Yes,
so do you think that there are any misconceptions out there about what podiatrists do that may confuse students?
Yes, very much so. I think that it depends who you ask, but I think there are people that just have no idea what we do, and then there are people that think that all we do is ingrown toenails and warts, which is some of what we do, but it's not all of what we do. I think there are sort of old school doctors that don't realize that we can do everything in the foot. So I do everything. I mean, whatever comes in. If it's a fracture, if it's a deformity, I handle little kids. I handle wounds. I handle anything comes in. So, but there's a misconception that if it's a wound, it should go to a vascular surgeon. If it's a skin issue, it should go to a dermatologist. If it's if it's something that needs surgery, then it should go to an orthopedic surgeon. At one time, that was the case, and there were things that were referred out. But I refer out things that I think that would be best handled by someone who specializes in that area. For instance, if I have a skin issue that I think is a little more serious, I might refer it to a dermatologist. But we have a good give and take, and they have stuff that's given to me. So I always tell referring physicians, send me anything on the foot. If I can't handle it, I'll send it out, and I'll honestly handle something that I think I'm skilled at, and something that I lack the skill set. I'm happy to send out, and I'm happy to collaborate with others. But at this point, we are as well trained in the foot as anybody else that's handling anything on the foot, any system of the foot, and the residency programs are far better. The training is much better even than when I got out. It's standardized, and it's good. And the students that are graduating today, or the residents rather that are graduating today, are very well trained, and they're knowledgeable, and they're hungry, and they're good at what they do, and they like it, I think.
Okay, great. Very good. So what does your typical day entail?
So my days in the office are, so my practice, I see, on average, about 25 patients for a typical day. So we see a pretty good amount of new patients. I'll see, a little bit of sports medicine. So maybe some heel pain, maybe some running issues. Usually it's either preoperative or postoperative. Somebody's coming in either planning surgery or following up from surgery. I'll get my share of, little old men and ladies that are coming in and getting their nails done for every few months. And that's part of what we do. And it's not glamorous, but it's good. Right. And then just sort of a garden variety of just whatever else comes in. And that's my typical days in the office. I have one day that I do surgery. Usually every other Tuesday I'm in the operating room. Almost every Thursday I'm in the operating room. And then I go to my office in the Bronx. But the days are busy. When I'm in my Bronx office, I see, around 30 to 40 patients for a day. Days are usually pretty busy, thankfully. I no complaints about that. And that's pretty much my typical day. It's on a good day, we're wall-to-wall patients. Like today, I mean, I just, we were supposed to have this call at 3:00 and we started at 3:30 because I was just, I figured I'd be done. But as is wont to happen, I wasn't.
That's okay. And what time do you typically enter the office and then leave the office?
I typically come in on Mondays and Wednesdays. I'm in the office from about 9. I get there a little before 9 or a little after 9. I'm there till about 6:30 or so. And so that's Monday, Wednesday. Tuesdays, depending on the day, I'm in surgery. Surgery usually starts early. Usually starts about 7:30.
Okay.
And on a good day, I'm in surgery from 7:30 till, somewhere mid-afternoon. And then I have an office that I go to. Some Tuesdays I'll come into my office. It's a little bit of a shorter day. And on those days, usually I have surgery in the afternoon at another facility. Thursdays are in the Bronx, so either I'm starting surgery at 7:30 or I'm starting office hours at about 10 and going till about 6 or 7 o'clock. Fridays are a little bit of an early day for me. I start office hours about 8:30, 8:45, and I'm typically out of the office by about 4 or something. But I stop seeing patients around 2, 3 o'clock. And that's usually pretty busy. And unfortunately, there's always stuff to do. So there's stuff to do at night, and there's always paperwork that I have to catch up on, or charts, or emails, or whatever it is, or phone calls. It's busy, but
Yeah.
I like it busy, but it is a busy life.
Okay. Good for students to know what they would be getting themselves into.
You got to work hard. I mean, whatever you do, you got to work hard. I've never met anybody that was successful that didn't work hard.
Absolutely. So what is your favorite part of your job? And then what is your least favorite part of your job?
I like surgery. I mean, that's really where I would be. I'd like to be in surgery at least one day a week and be doing the cases. I just like getting in. I love the environment. I love being in the operating room. It's just, I find it thrilling just to be in the operating, just to be doing surgery. It's great. But I like getting in and fixing things. I can take I can take a major deformity and I can fix it. And, in a span of, 30 minutes or 3 hours or whatever it is, I can take something that was, somebody's had their whole life that's bothered them or that's hurt them, or they couldn't walk or they couldn't move a joint, and I can fix it. And, in that time, and when they come out of the OR, it's a great feeling to know that the case went well, and it's not a great feeling to know that it didn't go well. Thankfully, it almost always goes well, and patients are happy with it. So I love the surgery. But I also like when just patients come into the office and they got something, listen, they could come in with a little callus that's been bothering them, that they've been walking around for, a couple months, and they don't know what it is. And I shave it, and it takes, 5 minutes, and they walk out feeling great, and they got a big smile on their face, and nobody's going to do that for them. There's no other field that's going to take care of that for them. And that's great too. I mean, that's a nice feeling. And I like being in the office too. I have really interesting patients. I like meeting them. In the Bronx, it's a little more of a homey crowd. It's it's kind of like being in their living room, and they're, but they're appreciative, and they're compliant, and they love it, and they're just, it's a family environment. So I like that. I like the camaraderie and just feeling like I'm doing something for them. And what I don't like generally is I don't like the business of medicine, and that's what every doctor will say. You have to deal with the business of medicine. So you have to deal with issues with insurance companies and billing, and sometimes patients get upset about things, or sometimes patients can be difficult. I don't, you can't always choose the patients. Frankly, I had 2 patients that came in today that were, I think, strung out on something, and it wasn't great. It was not a whole lot of fun. But, listen, to try to help them, try to do something good for them, and try to manage them in a way that's appropriate for them. Right. So, I don't love that, but you can get that in any job. You can get a boss that you don't like. So any job has its downsides. Unfortunately, when things go bad in medicine, patients have a way out, and that's, to use the legal system. So the litigation part of it, any doctor will tell you that the medical legal part of it is a drag. And unfortunately, it's a risk. And if you're a surgeon, at some point you will get sued. And that's, it happens, and it's part of the job. And it's just, I don't like it. You know? Yeah, so that's the thing. If I had to say the thing that if I could carve out anything of medicine, if I had a magic wand and I could carve out one thing, it would be the litigation. It doesn't benefit. I understand that there are patients need to have a recourse, and there are some cases where something really happens and a patient needs to have some sort of they need some restitution for what happened. However, it's a highly abused system, and that's something that needs to change. Maybe not in my career, but hopefully that would. But that would be my one biggest pet peeve.
Okay. Again, good for students to know not only the bright side, but also the other things to consider as well that maybe not be so fun.
My advice to students, though, is you have to go into medicine because you love it. You have to love what you do. You have to love the medicine. So the business of medicine, the legal parts of medicine, the stuff that's a drag, the patients that you don't like, it all, you just take it. I mean, that's just,
Right.
go into the medicine, love the medicine. Don't worry about the business. Don't worry about the law. Don't worry about the time it's going to take to train. Don't worry about any of that stuff. Just decide if you love the medicine, and in any field, podiatry or frankly, any career,
Right.
but especially in medicine, because medicine is such a long road and it's such a hard road, and there's so much you have to do, and there's so much you have to invest, and there's so much time and effort. But if you love it, it doesn't matter. It's a labor of love. So it's if you love it, none of that matters, and that's what you have to do. You have to go into it loving it. So that would be my big advice for the students. So the stuff that a lot of doctors will tell you, don't go into it. You can't make money at it.
Mm-hmm.
You can't start a practice. You're gonna you're gonna be buried in paperwork. It's not good anymore. None of that matters. None of that matters. You just go into it, get the best training you can, love it, and then you'll love it, and you'll have a great career, and you'll always feel good. There's nothing like being a doctor. There's no field that can match what you can do as a doctor. I mean, I don't know. I think it's the greatest calling, and it always makes me happy when I hear students that want to go into medicine. And I would encourage any student to do it. And don't listen to the doctors that discourage you.
Got it. And that was going to be my next question. What would be your advice? But you covered it.
Yeah, that's it. That's it. No, just do it because you love it, and make sure you love it. Make sure you really love it. Don't go into it for the money. Don't go into it for the money. Do not. You can make a very comfortable living, and thank God I do. I make a comfortable living. I'm happy with what I make.
Mm-hmm.
Could always make more, but it's a nice living. But that's not the reason to go into it, because if you're that smart and motivated and ambitious, then you can get an MBA and you can go work in finance, or you can work for Google, and you can do very, very well and not go through all these years of training and residency and everything else you have to do, and taking board exams and all the other stuff, and dealing with medicine. So there's easier ways to make money. So don't go into it for that reason.
Okay. What would you say, Dr. Isaacson, has been one of your most memorable or rewarding experiences with a patient?
I had a guy years ago that I got a call. I used to take a call at one of the hospitals. I got a call from the residents that told me that there was a patient that he was diabetic, and he came into the emergency room. He had redness in his leg that was going all the way up. Oh, no. And first they told us to come in and take a look at him, and then they called us back and said the redness is going all the way up and they're going to amputate his leg. And I said, don't let them amputate. I said, he's already going to lose the leg. Let us go in and see what we can do. And we went in and we filleted it open like it was like a piece of meat. And frankly, not to be too grotesque, but we opened his leg up, and I mean, I sat with it, and it was an open wound for 6 months, but we sat with it, and this guy's still walking around. He still got his leg. I mean, it was years ago, and he still comes to see me. And everybody's got that story of the guy you went in, and frankly, like, that guy would have been, he would have lost his leg.
Yeah.
We have, and there's other patients like that too. I mean, I had, I have a lot of diabetics that we have failures, but we have successes too. I have patients that have kept their legs for that. Mm-hmm. I had another patient that came to me. She was a 16-year-old girl with a flat foot. It was really, really flat. Like, she had trouble walking around. We did a major reconstruction on her. It was a 4-hour surgery. It took her a while to heal, but the next year she was #1 on their track team.
Oh, wow.
So yeah. So I mean, listen, these are experiences. But like I said, the person who comes in with an ingrown toenail that has been for years and it's been bugging them, and we take care of that, and I can take care of that in one visit, and they walk out feeling good. I mean, that's also satisfying. But it doesn't have to be, the heart transplant.
Right.
Just something good for somebody is also, that's rewarding on its own level. But certainly those stories stand out. The most are like the diabetic limb salvage stories, where you can save somebody's leg like that. And it's not so unique. I mean, every podiatrist, every doctor has some story like that. Right. The diagnosis they made, the patient they saved, the stuff they did, and unfortunately, they have the ones they missed. They'll tell the ones that they didn't pay attention, or they missed a sign, or they didn't do something right, and that weighs on you too.
Mm-hmm. Okay.
Yeah.
Well, great stories.
No, thanks.
That's,
It's full of stories.
I love hearing about the good stories. So thank you for sharing.
Yeah, no, there's plenty of good stories. If you look for it, every day has a good story.
Yeah, I love that.
Yeah.
Okay, would you recommend the field of podiatry to prospective students considering medicine?
I would, but here's the advice that I would give people. First of all, like I said before, go into medicine because you love it. That's number one. With podiatry, you have to think extra hard. You have to think of the fact that podiatry is a different field. It's not medicine, so you're not an MD. You're doing something different, which means that you're always going to have to sort of explain what you do. The way that I'm explaining on this conversation, I have to do that sort of explanation to people. And there are people that are going to look at it and say, like, it's a lesser field. and I can live with that because I know what I do and I know I'm good at what I do. So that's
Right.
fine. But you have to be able to live with that. So, like if one of my kids wanted to go into it and said like, they could go to medical school or they could go to podiatry school, I would say like if this is what you want to do, you want to be a foot doctor and this is what you want to do and you really love this, then that's what you should do. But if you're not really sure what you want to do, if you're not really sure that you want to specialize in the foot, then you have to really think long and hard if this is what you want to do. The other thing is too, like everything medicine has stuff that you don't want to talk about and you don't want to do. When I was a pre-med, I went to my pre-med advisor and he said, medicine, this is exactly what he said to me. I'm sorry, but this is what he said. Medicine is not glamorous. It's sticking your finger up someone's wazoo. So that was the advice that I got.
Yeah.
It still rings true. So, but I could fill in the blanks in other ways. People say like, how could you look at feet? How could you get into feet? And I always say like, I have a friend who's a gastroenterologist. He sticks cameras up people's wazoos and he does it all day long and he's very good at it. I have a stepbrother who is a urogynecologist who deals with old ladies who are incontinent and who every time they sneeze leave a puddle on the floor. And he saves them from wearing adult diapers their whole lives. It's, like not all that stuff is glamorous. So you have to be willing to go with that. In this field, you have to be willing to go in. And I have elderly patients who come in with the nastiest toenails that you could ever possibly imagine, and I trim them for them. Either because they can't do it or because if they do it, they're going to cut themselves and they're going to end up losing a toe because they're diabetic or they have circulation issues.
Right.
Again, it's not glamorous, but I get a relationship with them. They come in every 2 to 3 months. We should move a little bit. And, I take care of them and they're very thankful and I get paid for that. So
yeah, it's a necessity.
Some of medicine, and a lot of medicine, in fact, is how much would you pay me to do something really disgusting to your body? And this field has that. So you have to find your disgusting parts and that's what you do. So I don't, have to deal with, I don't have to deal with tummy issues and that's great. I don't have to deal with kids vomiting on me and, like pediatricians do. And I don't deal with, certain, like every field has its things that are kind of gross, unless you're going to be a radiologist and you're just going to look at the images all day. But, for the most part, any field that you're going to go into has certain parts of it. So what I would say, if a student really is serious about going into this, and I've had students shadow me many times. I have students, they come in here and they spend a couple days with me and they'll see what I do in the office. And I always tell them, like, look at what I'm doing and see if you could imagine yourself doing this. There's the cool stuff where people come in and, they're in a lot of pain and I give them one shot and they walk out feeling great.
Right.
Or the really cool surgery that, we look at the x-ray and there's all sorts of plates and screws going through. And then there's the old lady with the gross toenails. I mean, that's also part of it. And that's part of what I do. So you have to be willing to be able to do all that. And that's medicine. And so in any field, you have to really look at it and be willing to do that. So
yeah. Well, I appreciate the honesty. I think that these are the things students need to think about.
Yeah,
and it's good to hear it firsthand. So thank you for that. The next thing I want to talk about is podiatric medical school is quite an investment for students in both time and money.
Yes.
So what would be your recommendation for students to sort of think about as they're going through that decision-making process, if they're going to take the leap and make the investment?
To be quite honest, podiatry school typically has not been as hard to get into as medical school. And there are a good amount of people who go into podiatry because they couldn't get into medical school, and that's fine. Podiatry school, I don't know what the cost is like relative to medical school. I think it's probably a little bit less than medical school. A lot of the podiatry schools now have been either merged into or bought out by medical schools. So you're taking classes with medical students or with osteopathic students, and that's fine. But as far as getting into podiatry school, it doesn't make a huge qualitative difference where you go to school. I mean, the schools are all pretty good. And it's not really going to make a big difference. It's not like a Harvard of podiatry school. They're all pretty much on par. What does make a difference, though, is the residency that you get into. And the way you get into a good residency is to do well in school. So try to do as well as you can. In the 3rd and 4th years, typically, of podiatry school, you go on clinical rotations. So you're going to hospitals and to offices and things like that. That's the time to shine. So that's the time to really, pay attention and to get into the right programs and think about that those programs are where you're going to end up doing your residency. And where you do your residency is where you're going to get your training. And the better training you can get, the more training you can get, the better you're going to do when you get out. It means that you're much more marketable for initial job offerings. And it means that when you're out there and you're working, you have the better training. There's a lot of stuff that I do now, either in the office, in the operating room, a lot of stuff that I didn't learn in residency. And, I made up for it. I learned it and now I do it well. But there are a lot of procedures that I do and that's still going to be the case. But if you could do a really top-notch residency program where you're doing a lot of complex procedures and you're learning it. And if that's for you, and not everybody does a surgery, and that's fine too, but you try to get the best residency program that you can. And the best way to do that is to get the best grades you can and to really think about your clinical rotations.
Okay. Good to know. Thank you.
Thank you. Yeah, thank you.
As far as the financial end of the investment, do you think the investment that you made has been worth it for you? And what advice would you give students who are sort of thinking through, I'm about to take on a lot of debt, or I'm about, to spend a lot of money on this? What would be your thoughts there?
It's for me, I've had a good return on the investment. Like I said, I make a decent living. So it's been good. There's something about in medicine, in a lot of fields, like especially if you go into, I'm not going to lie, like if you come out of a cardiac surgery residency, or orthopedic surgery, or you're a dermatology surgeon, or an interventional cardiologist, you come out of these fields, you're going to be making, really like the job offers are significant, and more than you'll initially get in podiatry school. So if you're looking for the payout, pound for pound, the payout's probably going to be better in MD specialties than it will be in podiatry in a lot of the job offers. It's just the reality of how things are. So really, like, if that's very significant to you, and like if you're not sure that you really love this, and the money is maybe a little bit more of a factor, then, and you have the ability that you think you can get into med school and do well in med school and get into a really good specialty, then that may be the road for you. But if this is what you love, then that's what you have to do. What makes you happy, and you will make a decent living, and you can do well in this field, and you could do very well. There are people that do exceptionally well, and there are ways to tailor your business too. Like you have to hustle. This is not. I mean, listen, I'm doing this, but I have a publicist that works for me. We do digital marketing. I've had somebody that worked for me full time doing my marketing. You're running a franchise. It's like, when I was in medical school, we had a course on practice management, and the guy who ran it was a very good businessman. He was also a podiatrist, and he had gone back to medical school. So he was a DPM and an MD, and he owned all sorts of real estate and other things. And he used to say, like, who here wants to open up a McDonald's? And nobody raised their hands. He said, well, you're going to open up a practice, and it's the same thing. It's like running a franchise, because you have employees, and you have to pay taxes, and you have to market, and you have to do everything else, and you're running a business. So you have to be prepared to do that. So the point to answer your question a little more succinctly, people who go into primary care, typically, like internists that come out, or family practice pediatricians, I think on average, like a podiatrist will do better than, primary care. But again, like if you think that you want to take care of sick babies all day, and that's what you're good at, then you should do it. And if you love that, then that's what you should do. So yeah. Anyway, so that's, and again, like it comes back to, like, you have to do what you love, and don't go into this for the money, because if you're that smart and motivated, then, go and work for Facebook or Netflix, go work for one of the .coms. Yeah. But, or get an MBA. So
I got an MBA, so I can relate.
Yeah. And how you doing with that?
I'm doing well.
Yeah. All right.
I could never do medicine.
Get your own podcast
personally, because I just don't have the stomach for it. But I have a lot of.
Yeah, my brother got an MBA and a PhD from Harvard Business School, and he's doing well now. But in the beginning, he got some really good jobs, and he bounced around though to different companies. The grass is always greener. Always greener, because all the doctors are going to say, "Yeah, get an MBA." The MBAs are going to say, "Go into medicine," because it's a steady field. Because you're always going to make a living. Yeah, and the lawyers will say, "Do anything but law." Yeah,
I've heard that from a few lawyers. So
yeah, lawyers. I don't know, the career satisfaction of lawyers. It's gotten better, but around 2008, the career satisfaction of lawyers collectively was just in the toilet. So I think it's gotten a little better since then. But all right, listen, I'm not a lawyer, and I wouldn't encourage my kids to go into law, and I would encourage my kids to go into medicine. Very much so.
Okay. So tell us a little bit more about how people can get in touch with you and your practice if they are having foot or ankle issues or pain. How can they get in touch with you? Well
said, Margaret. You can call me. There is the telephone that still works, 212-420-6002. I have a website. It's drisaacson.com or nycfootdoc.com, at Dr. Isaacson on Twitter, at dr.funguy on Instagram, or you could just Google me. So for foot problems or any students that are interested, some students I've had for like a few weeks at a time. We're always open to having students. I have these students in the office. I always have them look around, and again, like I said, I have them see the most disgusting things. Eventually, if I find that a student has been here long enough, then I'll let them come with me into the operating room. But I never start with a student in the operating room, because once you go in the operating room, you'll never want to go anywhere else. Because it's just cool. No matter what you're doing, doesn't matter if you're removing a toenail or doing a heart transplant, walking in a pair of scrubs with your hands up like this is the most sexy act that you can do. This is it. This is the act with your hands dripping. I mean, any television show that that's it. That's what they show. The hands up phase. Like, that's it.
Yeah.
You're king of the world when you walk in like that. So, listen, there is something, I don't know, at least for me, I don't know, maybe it's not thrilling for other people, but yeah, you have to have a calling.
Definitely.
Yeah.
I agree.
Yes.
We need lots of different people to do lots of different things.
Everybody's got to find their niche.
Exactly.
Yeah.
Okay, so final question, Dr. Isaacson. If you could go back to your very first day of podiatric medical school,
yes,
what is one piece of advice that you would give yourself?
Work your tail off.
Okay.
Yes, I had an epiphany at one point during gross anatomy when I was walking around a bunch of cadavers taking a test, and they have little ID tags that are affixed to various body parts, and I was not doing well, and I could not remember the names of these parts, and I realized that I hadn't studied. What I also realized, the converse of that, was the more I sit and the more I plug away at this and the more I study, the better I'm going to do, and I just need to invest the time. And after that, I did. I got a C on that test, but after that, I really kind of shined, and I learned how to. I just learned that I just have to sit in the library, I have to do whatever it takes, and I have to just, study as hard as possible. So that would be the advice I would give myself. I would also pay very close attention to the clinical rotations. I regret some of the clinical rotations that I did.
Okay.
I wish I'd done some different rotations. There was an office rotation that I didn't do because everybody else in school was talking about what a rotten rotation was. It turned out that it's one of the most preeminent foot surgeons in America who I've met since then. It is the nicest, most gracious guy, and I wish I'd done a month with him. Who knows, maybe I could have gotten a residency with him. So think about the rotations that you do are the residents that you're going to do, and that's going to shape your entire career and entire life. So that's really important. That would be the advice that I would give myself. But as far as if I could go back and say I wish I hadn't done it, or I wish I could be an MD, or I wish I could do something else, I'm quite happy with what I do. I am very satisfied with this field, and this is a great field, and I've encouraged students to go into it. And it's a lot of fun. I'm my own guy. I have 2 different offices. I have people that work for me. It's great. You can do a lot. This is a lot of fun.
Excellent. Well,
can't you tell? Look, I'm living the dream right here, right here in my cramped office. I can show it to you, but it's not something that the students should see.
Okay. Well, Dr. Isaacson, thank you so much for coming and sharing your thoughtful insights.
My pleasure.
Lots of students, I'm sure, are going to find your story and your knowledge very helpful. So thanks so much for coming.
Thank you for doing this. Thank you for helping out the next generation. We appreciate your mentoring skills as well, and giving them the information that they need. And any students that want to contact me, please feel free to do so anytime. You can also just reach out to me by email. It's through my website. You can find an email, or if you go to info@drisaacson.com. That's DOCTORISAACSON.com. You can just email me, reach out to me. I'm happy to talk to anybody and answer any questions.
Great. Well, thanks again.
Okay, you got it. Yeah. All right.
Thank you for listening to eQuez Audio. To learn more about podiatry and to explore schools, head over to eQuez.com. That's EQUEZ.com to get personally matched to best fit programs. If you enjoyed listening, be sure to subscribe, and we would love for you to rate and review us. Keep in mind that our discussion today mentions views and opinions that are personal in nature and do not necessarily reflect the official policy or position of any university, agency, organization, employer, or company, and should be used at your own discretion. We wish you the best in your quest for education.